high-risk pregnancy, critical care, minimal invasive surgery, Gynaecology, menopause, and yoga. And as you can see that I am holding many posts at various levels. And at the moment, I am chairperson HIV and AIDS and secretary general elect IMS 2022. I was president Jaipur Obstetric Society, Jaipur Menopause Society, committee chairperson Public Awareness Indian Menopause Society, and vice president Jaipur Obstetric Society and secretary Indian Menopause Society Jaipur chapter. And I have held many post earlier with many awards to myself. Now today we are going to discuss about cervical cancer and about this awareness. So as you also, which is preventable, and not only even for all of the world, even WHO is going for in the direction of eliminating this cancer from the earth, with the motto of eliminating this cancer by 2080 or 2085. So that's a target which everybody is targeting with the aim of preventing at primary, secondary and tertiary level. So in India, it is sad, but it is true that we have about 200 women die each day due to cervical cancer, which is a huge number. And so we can act at every level, starting from a girl, child to a woman, adult woman to a menopausal woman, and stop this cancer. And we all know that cervix is a part of woman's womb, which is also known as mouth of uterus, and this is the cancer of this area, which is the second most common cancer in our country in the woman. Now, it is basically, whenever we talk about cancer, it is uncontrolled growth of an abnormal cells in any part of body, and it could be because of chemical like smoking, radiations, and microorganism, that is bacteria and viruses. Now, in India, it is 27%, that is almost 1/4 burden in the world. So we have about 27% new cases in the world. And when we all know that, again, we have a huge population. So the deaths due to the cervical cancers are again about 20%. Now, when we look at the statistics, we all know that 1 in 10 women have been screened for cervical cancer in 5 years. About 45,000 cancer deaths occurred alone in 2009, and 30% were diagnosed in the age of 15 to 49, and about 18.7 women, the cancer incidence was in per 100,000 women. There is though decrease in deaths from 2000 to 2019, but still the numbers are very huge, and the death rate though declined by 2%, but it is still the second most common cancer. When we look at this graph, we see that cervical cancer is, the most common cancer, and followed by breast cancer, oral cavity cancer, and other cancers. Now, this is caused by a human papillomavirus. It's a virus, and the most common strains of this virus are HPV 16 and 18, which leads to this cancer, and also HPV 6 and 11 gives rise to warts. Though there are many other cancers, but most of the cases, the cancer is occurring because of this genome. And it is also responsible for vaginal and vulval cancer in more than 50% of cases. And as I just said, that 90% of the cause of anogenital warts is because of this HPV 6 and 11. Now, human papillomavirus is occurs in the cervix, vulva, vagina, and penis, and it can lead to vault or condyloma like lesions with squamous intraneoplastic cancer. It can also do diseases in head and neck, and the other cofactors which are responsible for increase in incidence are smoking and alcohol. The incidence is, in 5 to 10 years, it develops cancer from the type of infections. Almost 90% of the women are affected at some time of their life with this virus, but it is self-curing. It only affects the epithelium via viremia, and resolution occurs secondary to antibiotics and activated CD4 count and lymphocytes. When we look at the natural history of HPV infections, is the infection leads to lesion in the cervix, which can develop into a precancerous lesion in CIN 1 to 3, and then later to invasive cancer. So this can be measured by HPV detection and, of course, relative frequency of increase with severity of the lesions. The factors which are responsible for infection of HPV are long-term use of hormonal contraceptives, early initiation of sexual activity, high parity, tobacco smoking, both active as well as passive, other STIs like chlamydia, immune suppression, HIV, and multiple sex partner, and of course, low socioeconomic status, along with the pure diet, which is poor in antioxidants. Now, when we look at the carcinogenetic factor, there are 3 steps. Initial viral infection of the normal cervix, which leads to infection of cervix, which can get cleared or which can progress further into a precancerous lesion, which again can regress. And some cases, this lesion may progress into an invasive cancer. So the natural history of HPV and cervical cancer is, there is, when a persistence of infections, which can lead to a precancerous lesion and a full-blown cancer. Now, there are different signs and symptoms starting from vaginal bleeding to heavier menstrual bleeding, then normal, usual, and then bleeding after menopause or increased vaginal discharge. Bleeding, postcoital bleeding means bleeding after sex, and pain during intercourse. The different risk factors are infection with human HPV virus, and mostly, as I said, more important is HPV 16 and 18, followed by 13, 1, 33, and 45. And most of the cases, more than 50% is caused by 16 and 18. Of course, sexual behavior we have already discussed. Smoking we have already talked. HIV infection, chlamydia, diet, we have already discussed these points earlier. So how do we prevent it? By avoiding the risk factors, especially HPV infections. Help for we need to help low socioeconomic women, having their screening through Pap test, and of course every 3 years after first vaginal intercourse by the age of 20 men. And when doing a colposcopy is very important, where you can detect different type of cases from CIN 1 to CIN 3. These are the few diagrams to show you the CIN. And when there is sexual intercourse, in vertical transmission to mother to child and from mice, and HIV at any time of the life. So be aware and consult your doctor immediately whenever you have any kind of abnormal discharge, in spite of treatment, foul smelling, thick repeated vaginitis, UTI, postcoital bleeding, non-healing recurrent cervical lesion, irregular and intramuscular in the premenopausal phase. We need to screen all the women who are heavy chronic pain, distension, loss of weight, heavy bleeding, menopausal bleeding, cervical polyps and tumors during or before menopausal age. So the next question arises, is it possible to get protection against cancer? Yes, it is the only cancer which is now virtually preventable disease due to early vaccination, screening strategies, long natural history and cervical screening. Now, secondary prevention may help in early detection of cervical abnormalities, and with the use of screening program, we can do secondary prevention or screening, helpful for detecting the cancer at the earliest stage, hence useful for saving the lives, reducing the mortality and morbidity. So what are the tests available? For a low resource setting, we can do simple visual inspection, VIA, Willy, Pap smears, which could be conventional or liquid based, or there are still some experimental tests like HPV DNA testing, cervical echography, PapNet, and polar probe. So we need, when we look at the guidelines of different agencies, ACS, ASAP, ACP's guidelines, they all say that we must screen all the women under the age of 21, and women should not be screened, regardless of the age of sexual initiation and other risk factors. And 21 to 29 recommend screening cytology every 3 years. This is a grade A recommendations. And then recommendation of screening every 3 years for women who want to lengthen the screening interval. Screening with combination of cytology and HPV testing every 5 years. So these are the few guidelines. When we look at these guidelines, the recommendations always stress upon the need for screening. So why we are talking of Pap smear? Pap smear is very simple. It's sampling of cervix, involves scraping of cervical surface, a portion of non-visualized cervical canal using various sampling devices. Basically, we are scraping the cells from transitional zone of cervix, wherein we can take the cells from both the areas, because this is the area which develops into a cancer. So as we all know that prevention is better than cure, this holds more true for cervical cancer than anything else, and we can do it by regular Pap checkup, and it is very easy, painless, reliable, and it reduces the cancer by 75% in developed worlds already, and repeat Pap is advised if it shows abnormal cells, and then we need to do a colposcopy and colposcopic directed biopsy. It can give us early diagnosis of cancer and before it sets into in, and hence early treatment can avoid disease. Now, what is the significance of Pap? We can detect precancerous cells and invasive cancers in early stage. Positive screeners can be selected for selective tests. With treatment, progression of disease is halted, and thus morbidity associated with advanced cancer decreases. Mortality also reduces by 20 to 60%, and it helps us in study of natural history of disease. Now, I was talking about transformation zone. It is very, very important to understand that cervix develops from two embryonic sites, that is from Mullerian duct lined by columnar epithelium and urogenital plate, which is lined by stratified squamous epithelium. So point at which columnar and squamous epithelium meet is called as original polymeral junction, and this is the area where cancer develops. So under the influence of estrogen and original movements into portion, exposure of delicate columnar cells of vaginal nerve leads to squamous metaplasia, and transformation zone is an area of squamous metaplasia, an area between original and new squamo-columnar junction. So this is an internal os, you can easily see, and the dark area is the nectocervix, and metaplasia takes place in the transformation zone, and this is the endocervix, we can all see very well, and then native and new squamo-columnar junction can be seen very easily in this picture. So we need to understand this because exposure of transmission zone to carcinogen changes begins in the process of intraepithelial neoplasia, While exact role of carcinogen in its process remain poorly understood, it is clear that HPV and cigarette smoking can cause dysplasia at transformation zone, and 95% of the cancer develops in transformation zone. And importance to take a sample from this area is very, very important. So in Pap smear, the cells are taken from the cervix by putting in a speculum and a spatula, and then the smear is prepared, which is then observed under microscope from all the area from 360-degree angle. It is not recommended in virgin females. It is recommended every 3 years for all females more than 30 years. So as I have already explained that it is very important to know how to take a Pap smear. You take a spatula which is rotated at through 360 degrees. Use a mild force so that there is no bleeding. No, too little force will give rise to inadequate sample. So it has to be a balanced thing. Sample is smeared evenly on the slide and fixed immediately, and both slides of spatula are to be smeared. The endocervical sample is collected using an endo brush. Insert the cytobrush into the canal so that last blister of brush is visible. Rotate the brush through 180 degrees or more rotations to increase the chance of bleeding. Sample is rolled on the slide and again fixed. Fixation is done immediately by 95% alcohol or cytofix spray. Spray should be kept within 10 inches to avoid destruction of cells. Smear should be monolayer for proper penetration of cell surface and fixating. After fixation, it should be sent to the histopathology lab. Now, liquid-based cytology, little about it. Several sites can be prepared from one smear. Chlamydia and HPV testing can be done at a later age. Reduces the incidence of inadequate and repeat smears. So HPV test is a very accurate way to tell high risk of HPV. This can use the same sample, and a positive means a woman is at a higher risk and of developing a cancer. So when should we do HPV? To see if the woman is with borderline Pap test, or to screen for cervical cancer along with Pap test in a woman more than 30 years. When we talk of preventive methods, only less than 1% progress to cancer. Lifetime risk of genital HPV is 50 to 80. Lifetime risk of genital wart is 5%. And risk of ICC in women is 4% and 1% in regular screening. Pap should be used to find cellular abnormalities in the cervical tissue. Then colposcopy is again very important. Whenever there is an abnormality seen in Pap smear or visual inspection, colposcopy, which is magnification of cervix and vagina with light magnifying instrument after application of vinegar to the cervix or acetic acid. Because it is magnified examination with low power and a stereoscopic microscope with powerful light source, it helps in diagnosis of cervical neoplasia. The key ingredients are observation of features of cervical endometrium epithelium after application of normal saline, and then dilute acetic acid and leukodidine solution. As I have already said, the indications are whenever there is abnormalities found or persistence of inflammatory cells in spite of medical treatment, presence of keratinized cells, VIA positive, Willi positive, evaluation of HPV, postcoital, postmenopausal bleeding, unhealthy cervix, treatment and monitoring of women with CIN and other lesions which are present. So the objectives are to see the presence of invasive cancer, localize the scomocolumnar junction, identify the most severe disease for biopsy and evaluate the extent of disease. So this is how we see the transformation zone and see everything in detail. Then grading of abnormal colposcopy findings is, I'm not going into details, and these are few of the films from taken from the transformation zone. And as we can see, postmenopause is difficult to visualize. There is some squamous metaplasia seen with white line corresponds scomocolumnar junctions and tongue of immature squamous metaplasia with crypt opening at 4 and 8 o'clock position. These are again few slides with the polyp and usually benign, may obscure the underlying neoplasia. Therefore, all patches observed before application. So these are few of the pictures of CIN1, 2, and 3. And this is a geography satellite lesion. We can easily see, and a low-grade lesion. Again, thin acetoid lesion with graphic margins in the upper lip. Then moderately dense acetoid lesion with irregular margins, and circumferential acetoid lesions around the cervix, moderately dense, and these are different pathologies on a colposcopy. And this is a picture of a carcinoma C2, and this is pre-clinical invasive carcinoma. Early diagnosis will help us easily treating this patient. And this is inflammatory lesion of, because these are, so this is which I wanted to touch. Why are we talking of primary prevention? Because in the world now, this is the only cancer which can be prevented by vaccination. There are two types of vaccination available in the country. Gardasil, which is effective for 6, 11, 16 and 18, and Cervirex, which is effective for 16 and 18. And these are made by recombinant DNA technology, and they are for prevention of cervical cancer, vulval vaginal precancers, and Cervix is only indicated for cervical cancer. Effectivity is very good, from 98 to 100 and 92 to 94%. And when we give these vaccines, it can be included in the vaccination schedule of girls above 9 years, and it can be given up to the age of 45 years. The most effective time for vaccine is when they are before they are sexually active, and there are 3 doses. First as elected date, second after 2 months, third after 6 months. And for cervix, 0, 1 and 6. And side effects are usually not seen. They are very safe. Falling only sometime in injection site reaction or a very common edema and pain swelling. Sometimes there may be pruritus, but most of the time there is hardly any problem. So when we talk of pregnant women, can we give them any injection during pregnancy? There are no trial which show that it is recommended during pregnancy. And so if a woman takes first dose, the remaining dose should only be taken after delivery. Lactating women can take this vaccine very well. Is it very costly? No, it is not. We can see with normal modern lifestyle, vaccine costs nothing. People give so much rupees for things for their daughters for back. So cost of vaccine is nothing compared to the dowry cost in our country. So to summarize, screening and vaccination, do we do screening even after giving vaccination? Yes, we have to do screening even after vaccinations. And is this vaccine being used for another developed countries? Yes, this vaccine is available in 156 countries, and till date 200 million doses already used within 9 years. And the vaccine has reached millions of people in so many countries. So primary prevention is the most important, and preventing the other aspects of lifestyle like social change, avoid early marriage, multiple partners, use of condoms and HPV disease, improve nutrition, personal hygiene, preventing smoking, alcoholism and regular exercise, and of course health awareness, health checkups are very important. So to produce a cancer-free society, screening, identification of high-risk groups, education, think of cervical cancer as extension of STDs, behavioral changes are very, very important, and HPV vaccine to be promoted at the right age. So let's all fight against cancer, join hands, take preventive measures, update yourself and take care of each and every person around you. Thank you very much. I will like to stop share my presentation.
Good evening, ma'am. Sandeep, this side. If you can hear me,
I can hear you, but why? Yeah, your voice is audible, but why I am not seen?
I can see you, ma'am. I can see your screen.
Yeah, okay.
I'm Sandeep from Gurugram. So I have 2 questions. One is the cost, because there should be something that we can share with people that this is the cost, approximately cost that is involved in this vaccine. At the same time, what are the risk factors of cervical cancers?
I have already repeated
Ma'am,
this topic at least 6 times.
ma'am, at that time, na, that the connection was not. I'm so sorry. I will. This presentation is on. Priya, this presentation is on YouTube also or on your platform also.
Sorry?
Priya, this presentation is available on the platform also.
Yes, it's
Because I
available.
have bought
Yes,
the subscription. I have bought the subscription, na, about from your application.
yes. You can find out the details over there.
So, and what is the cost if I ask?
So there are
Approximately.
basically two types of vaccines available.
Mm-hmm.
Cervarix and Gardaris, which you can find out